Assalamualaikum and a very good day, everyone. My name is Siti. I'm going to present on the impact of COVID-19 on Malaysian economic performance. Introduction. Many studies in the past, they have focused on medical research and the direct impact towards health sector compared to the economic and other sector impacts of the outbreak. Hence, for COVID-19, it requires in-depth study by experts and academicians, as well as multilateral collaboration to address the impact of crises on all affected sectors. In line with the recommendation of WHO, most of the country imposed lockdown measures to contain the spread of this epidemic. However, it had a devastating impact towards the economic sector of the country. The economic growth forecast is uncertain due to the first major pandemic that has paralyzed almost all domestic and global economic activities. Government has spent billions Malaysian ringgit through 7 stimulus packages to alleviate the effects of the economic crisis and promote the country's economic recovery. So this paper will examine into COVID-19 impact towards Malaysian economy by looking into GDP and key macroeconomic variables, private consumption, government expenditure, investment, exports, imports, and unemployment rate. So the finding of the study will aid in a better understanding of COVID-19 impact on Malaysian economy, as well as giving input for policymakers to making the best decision for economy's revival and be guided with the MCO measures to ensure that all sectors are well managed. Next, we are looking into literature review section. First, to look into the economic impact of previous infectious disease outbreaks. So far study evidence that infectious disease outbreak give substantial impact to its economy based on the withdrawal of individual from the labor force, and in these with supply shock reduce GDP through reducing employment, which leads to lower output and export, and through lower import owing to lower household income and shrinking output. So basically, we are looking into 3 or 4 pandemic here. First is Spanish flu 1918, study by Martin and Robert, shows that negative impact towards capital income, consumption, and GDP of the country. And then SARS, largest economic impact was towards GDP, investment, tourism sector on some Asian countries. Studies by Chong and Warwick in 2004, and influenza pandemic in UK and West African Ebola pandemic caused significant loss towards the country's GDP. Study by Richard and also based on World Bank Group report. Second part of the literature review is the impact of COVID-19 outbreak on the economy. Although it is impossible to predict the exact economic impact of the COVID-19 pandemic, with new variants or mutation of the virus keep emerge, leaving the economy uncertain. Economic analysts believe it will have significant negative consequences for the global economy. According to Marcus, in his study on the impact of COVID-19 towards the UK economy, found that with the lockdown approach implemented for 12 weeks, resulted in a total cost to UK economy of £308 billion, or nearly 13.5% of UK GDP. And then performance of the US economy continued to worsen for a few months after April, followed by a drop in employment rate, increase in unemployment rate, consumption falls, and industrial output falls. And they also predict that consumption will begin to increase after July 2020, but will never fully recover to pre-COVID levels. This is study by Jojo. And mandatory business closure was accounted as major element of losses to US economy, study by Terry. Study by Monica of the impact of COVID-19 towards India GDP is expected to reduce India GDP growth rate to below 3% at the cost of 21-day nationwide lockdown is equivalent to 1% point of GDP. So it is true that the introduction of confinement will significantly restrict economic activity of the country, but it will also minimize the risk of disease and mortality in the society. Non-confinement, on the other hand, is likely to maintain activity with serious consequences for the country's health environment. Study by Zakaria. Okay, for methodology, the focus of this study is to assess impact caused by COVID-19 to Malaysian GDP and the key macroeconomic variables. And the data and information used in this paper is secondary data obtained from the website WHO, Ministry of Finance Malaysia, Bank Negara Malaysia, Department of Statistics, Matrix, and reputable online mass media websites. This paper also included archival data from journal publication, reports and relevant policy documents, and policy feedback literature relevant to the pandemics. I also adopted quarterly data for period of quarter 1 until quarter 2 2021. Now we move to finding and discussion section. So first we are looking into gross domestic product (GDP) of Malaysia. As you can see from the chart here, we are looking first we are looking into quarter 1 2020. So initial phase of the COVID-19 outbreak. The GDP grew still positive at 0.7%. Significant decline in economic activity and global economic performance also definitely affecting Malaysia economy. The growth supported by services and manufacturing sector, while the rest of the sector is at negative growth. This is the lowest growth recorded since the third quarter of 2009, and because of travel is prohibited and almost all sectors are closed except for essential services sector. The fall also due to continued fall in oil prices. For quarter 2 2020, GDP contracted significantly at negative 17.1% because all production sectors are at negative growth, and the decline reflected the impact of the lockdown measure to control the COVID. Malaysia government introduced Prihatin stimulus package effective April 2020 to cushion the COVID-19 impact. And then on Q3 2020, there's an improvement of GDP but still at negative 2.7. The recovered performance of manufacturing sector boosted the growth, and CMCO and RMCO started on May and June, where most economic sector and activities interstate travel are allowed to operate, except area in enhanced MCO. But in quarter 4, just a slightly drop from quarter 3 to negative 3.4%. But basically, for Malaysia GDP performance for 2020 declined at negative 5.6% compared to positive growth of 4.3% in 2019, influenced by fall of all economic sectors due to COVID-19. So in quarter 1 2021, GDP still negative but at a better growth compared to previous 3 quarters. MCO 2.0 implemented but less stringent than MCO 1.0, and various stimulus packages to steer the economic recovery. The economy also spurred by disposable income due to the withdrawal of ICNA, ILSTARI, and an increase in commodity prices such as oil, palm, and rubber. And in Q2 2021, GDP increased tremendously at 16.1%, mainly supported by the improvement in domestic demand and continued robust export performance. So we move to private consumption. So in Q1, private consumption decreased 8.1% compared to last year's 6.7% due to reduce in consumption petrol, travel, recreation, and outside food consumption. So bantuan sara hidup and cut in OPR helped the spending and cushion the impact of MCO movement restriction. So for Q2, aligned with the GDP performance, private consumption dropped significantly at negative 18.5% due to the MCO and income losses. Bantuan Perkhidmatan Nasional Cash Transfer (EPF) withdrawal and the implementation of the loan moratorium helped to cushion the consumption spending. For the third quarter 2020, the private consumption posted a smaller decrease at negative 2.1%, backed by the expenditure on the essential items such as food and non-alcoholic beverages. Non-essential expenditure indicated better negative growth in this quarter. Low price of fuels, competitive prices of tourism products boost the domestic travel activities within states. Online shopping activities increase. Growth on purchase of cars also increased due to the exemptions of sales tax. In Q4 2020, slightly decreased for the private consumption, negative 2.1 to negative 3.4%, attributed by the decline of non-essential expenditures. However, spending of essential items showing a better growth during the quarter. So for Q1 2021, private consumption decreased at negative 1.5%, better than Q4 2020, even though implemented the MCO 2.0, household spending was smaller compared to MCO 1.0, given less restrictive containment and most economic sectors were allowed to operate. And then Q1 performance influenced by better expenditure on essential items, where non-essential expenditure indicated a slower decline in this quarter. For Q2 2021, where private consumption contributed 55% of GDP in the Q2 2021, increased significantly at 11.6%, attributed to the higher consumption in transport, food and non-alcoholic beverages and communication. High spending in transport due to higher purchase of motor vehicle in the first 2 months of the quarter compared to the same period last year, and non-essential expenditure recorded positive growth during the quarter. We are looking into government expenditure. So for Q1 2020, government expenditure increased from 1.3% to 5% due to spending on supplies and services. For Q2, all demand components recorded negative growth except for government expenditure, where it's positive growth of 2.3%. This is due to expenditure towards health, safety and security sectors. And Q3 a further increase to 6.9% due to higher spending in supplies and services. But in Q4, government expenditure decreased to 2.7% due to lower spending in supplies and services. In Q4 is also account for emoluments mainly to meet the staff requirements in critical sectors as well as stimulus spending. For in Q1 2021, government expenditure rose to 5.9% due to higher spending on fixed assets by federal government as well as healthcare and security sectors, and continued to expand into Q2 2021 due to higher spending on supplies and services towards the health-related expenditure in this quarter. So then we look into the investment on fixed asset. For Q1 2020, investment posted a negative 4.6%, a drop compared to Q4 2019 due to the sharp decline in all three segments, which is structure, machinery, and equipment and other assets. So lower capital spending from both the private and public sectors due to weak global demand conditions and disruption to supply chains, and the investment project also stopped due to the MCO. So for Q2, investment further contracted at a significant negative 28.9%. So, but in property 2020, the investment showed improvement at 11.6%. Recovery supported by the resumption of construction activity as the gradual lifting of movement restriction, and also by capital spending in the electronic and electricals and healthcare related sectors. For Q4, the investment slightly dropped from Q3 2020 since capital spending from both private and public sectors remain weak. So in Q1 2021, the investment registered a smaller contraction of negative 3.3, supported mainly by the recovery in capital spending from the private sector. The recovery indicated an improving trend, which was backed by the expansion growth in machinery and equipment at 10.3% compared to negative 9% in Q4 2020. The gradual improvement of investment can be seen as a catalyst for higher economic capacity to uplift the production of the future output. So in Q2 2021, the investment recorded of tremendous growth of 16.5%, supported by continued capital spending in telecommunication related equipment, continued progress in national digital infrastructure investment, increased investment in export-oriented industries such as E&E and metal. For export in Q1 2020 dropped negative 7.1% because China began to reduce service started January 2020, decrease in services export due to decline in tourist arrival to Malaysia. So Q2, another sharp contraction at negative 21.7% affected by lockdown globally, and enhanced weak demand from key trade partners, and weaker commodity prices affected production. In June 2020, Malaysia export performance showed gradual recovery, registering a positive growth. In Q3, improved at negative 4.7%, attributed by the export-oriented industry recovery in the higher E&E exports, and borders are still closed for tourism activities, hence the export of services remain in decreased trend. In Q4, recorded another improvement at negative 1.8% because of the continuous positive growth by the E&E exports, and export recorded better growth as compared to imports. For Q1 2021, strong growth of exports of 11.9% due to the positive growth in export-oriented industries. Export services continue to decline because still cannot travel, and the robust external demand, particularly for E&E product, at 26.9% compared to Q4 2020, and in Q2 2021, another tremendous growth at 37.4%. Positive external demand fuel robust exports across of all goods and markets, strong demand for petroleum and chemical products, manufacturers of metal and machinery and equipment and parts, 55% compared to Q1 only 19%. That's boost the export. We move to import. For Q1 2021, import dropped to negative 2.5%, 0.1% lower than Q4 2019. Imports of capital goods declined by 26.8%, which affected the overall import growth. Q2 further dropped to negative 19.7% due to weaker manufacturing activity, and Q3 import of goods and services registered a lower decline at negative 7.8%, because there's improvement for goods, but import of services further declined due to a lower outbound traveler, higher imports of industrial supplies and fuel and lubricants amid the recovery in manufacturing activity. Consumption imports grew, driven primarily by higher imports of consumer durable goods, and in Q4 recovering and recorded a negative 3.3%, primarily due to moderate contraction in intermediate imports. So lower domestic investment activity and household spending resulted decline in capital imports and consumption imports. So in Q1 2021, there's a robust growth at 13% due to improvement in all import areas driven by capital import, increased higher import of telecommunication equipment and machinery, and increase in industrial supply imports. In Q2 2021, import recorded growth of 37.6% due to stronger expansion of intermediate imports, increasing owing mostly to greater imports of industry inputs, which coincided with a quicker rise in local manufacturing activity. However, negative growth recorded in capital import at negative 8.3%. And lastly, we look into the unemployment rate. So for 2020, basically overall unemployment rate was at 4.5% compared to 2019, 3.3%. This is the highest rate since 1993. So as you can see here, for Q1 is at 3.5%. And then for Q2, it rise to 5.1%, the highest unemployment rate due to MCO and drop in demand caused firm to respond to cost-cutting initiative and tourism-related sector as highest contribute to the job losses, followed by manufacturing sector. So for Q3 2020, improvement on unemployment rate from 5.1% to 4.7% due to positive hiring activity as demand condition normalized. Employment insurance system recorded lower job loss compared to Q2 2020 with placement rate of 22 per 100 people retrenched. Placement rate here means number of people placed in new jobs under EIS program for every 100 employees laid off. So for Q4, there's a slightly increase from 4.7 to 4.8%, because the reimposition of the movement restrictions, but and then it remains towards Q1 and Q2 at 4.8% of the unemployment rate. In Q2, there's an improvement in labor market in the first half prior to MCO 3.0 in June. So as a conclusion here, strict lockdown with movement and economy restriction greatly impacted Malaysia economy as reflected in Q2 2020 economic performance. Sizable and credible fiscal support and accommodative monetary policy, not only for short term, must have for medium term, is critical to cushion the COVID-19 impact to support a sustainable economic recovery. The government should adopt COVID-19 adaptation measures to improve the economic resilience. Steady economic recovery is not assured, and with ongoing uncertainty surrounding the dynamics of pandemic, including the success rate of vaccination program around the world. So the Asian Development has revised Malaysia 2021 growth forecast to 5.5% because of bad COVID-19 cases in Malaysia. So, as a COVID-19 pandemic is a global crisis that necessitates a global effort and collaboration to overcome and manage not only on health sector impact as well as trade and macroeconomic policy. Thank you.